about Hellp and how it comes to neuro-op, and it's mnemonic and acronym. It's hemolysis with elevated liver function studies and low platelets. It's a consequence of an obstetric complication that normally happens late in the pregnancy from preeclampsia and eclampsia. And so you have placental insufficiency. It's not really clear how this would lead to the downstream effects, but the hypothesis is that placental abnormality is stimulating vascular and inflammatory cascade to bring more blood to the site. And so that activation of that inflammatory and coagulation cascade has a final common pathway, which is endothelial cell dysfunction. It is that endothelial cell dysfunction that's going to bring us back to neuro-op. So you should know that what happens with the activation of the acute phase reactants, the inflammatory cascade, if platelets go down, they're being consumed. The endothelial damage leads to hemolysis because it's shearing the red cells as they pass by the abnormal endothelium, and it's going to affect your liver function with elevated liver function studies. So the primary driver is placental insufficiency or abnormality, leading to activation of inflammatory cascade and endothelial dysfunction as the primary final common pathway for the Hellp. So now to the eye, the hemolysis, the anemia, and the thrombocytopenia can present to us as an anemic retinopathy, which means hemorrhages in the back of the fundus. But because of the preeclampsia, eclampsia, you have to worry about hypertension, and that means all the grades of hypertensive retinopathy will be at play. Again, endothelial cell damage, so hemorrhages, cotton wool spots, and because of endothelial damage, serous detachments. So we're going to have exudative retinal detachments, and it can present with disc edema to us. So the Hellp syndrome is an OBGYN thing. Its mechanism and pathogenesis are ill-defined, but presumably placental abnormalities lead to activation of thrombotic and inflammatory cascade, final common pathway, endothelial dysfunction, and can produce anemic and thrombocytopenic hemorrhagic complications in the eye, retinopathy, preeclampsia, eclampsia, serous detachments, hypertension, and in the brain, posterior reversible encephalopathy syndrome.